Hello, how are you today, Sally? Okay,
I'm all right, thanks, Mel.
good stuff. So thank you so much for taking the time to talk to us about pelvic girdle pain. Um, so we met, didn't we? Because you are my chiropractor,
I am indeed.
and you literally gave me my life back after a really hard time with pelvic girdle pain throughout pregnancy and postpartum. So, um, I just wondered if you would mind sort of just saying a little bit about who you are, what you do. Obviously, we know you're a chiropractor, but
Yeah.
who you treat and how you treat people and how long you've kind of been doing it. Just a bit about you.
So I am a pregnancy and postpartum chiropractor. I'm based in Manchester in the UK. Hope you don't mind. I'm filming in my daughter's bedroom, so I've got a unicorn and a rainbow behind me.
No, it's fine.
I've also got two children. I've had, I would say, mild, moderate pelvic girdle pain myself, so I've got lived
Mm.
experience of it. And in my clinic, I've specialised in pregnancy for probably about 15 years. And I see lots and lots of women with pelvic girdle pain at all stages of pregnancy and after they've had the baby as well. Um, yeah, and I'm going to tell you today a bit about chiropractic treatment and symptoms and how to know whether you've got it and what you can do about it.
Amazing. Thank you very much. So you've said you see a lot of women with pelvic
Mhm.
girdle pain and you treat a lot of women with pelvic girdle pain. Do you know how many you've sort of treated over the years? Can you think of, or if you were to put a number on it?
It must be into the hundreds,
Mhm.
definitely, because I probably treat it every day in
Yeah.
clinic.
And that's a really powerful thing for people to know, I think, because it's so unknown, isn't it? I mean, when I rang my doctor to tell him my symptoms, like he didn't even know, he had to Google what it was. So to know that it's so
Yeah,
common.
which is such a shame because 15 years ago when I started, that was how it
Yeah.
was. And I sort of thought, oh, it's getting a bit better and it's getting a bit more known,
Yeah.
but there's still a lot of women that aren't diagnosed with it and don't know. And lots of women come to me, and as soon as they start talking and describing their symptoms, I'm like, yeah, that's definitely PGP.
Yeah.
And they've not realised that that's what they've got.
Yeah. And have they even heard of it, do you think? Or some of them have they?
Quite a few who come. I suppose the fact that they found me might be because they've
Mm,
already found, an organisation like the Pelvic Partnership, or they've,
yeah.
read about it or seen about it, and they think, oh, have I got? Is that me?
Yeah.
Yeah, some don't know at all,
Mm,
but women are getting more educated about it, I think, which is great, and thanks to
mm,
work of the Pelvic Partnership.
yeah. Well, that's really good to hear. Um, so I guess you talked there about women coming to you with their specific symptoms, and could you talk a little bit more about kind of what they would present with if you said when you instantly know it's pelvic girdle pain, like
Yeah.
what are they coming to you with? What are they saying?
So the first thing to know about PGP is there are so many different possible symptoms and combination of symptoms, and you might have some of them or all of them or a few of them. Your pelvic girdle pain might look totally different to your friend's experience of it in terms of where you feel the pain and what you can and can't do.
Mm,
But these are the classic
classic.
things that when someone says, I'm like, ding, 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 that's
Yeah.
pelvic girdle pain.
Okay.
So if they say turning over at night is really painful, obviously, like it's where they're getting the pain as well. Like I've got
Mm,
my handy pelvis to show you. So
yeah.
the classic site of pain for PGP is right at the front here. So like right at the front of your pelvis. And
Okay.
sometimes people feel it like almost underneath as well. And then the other sites around the back, you might get pain like here, it's more into your bum than into your back
Yeah.
and
Yeah.
maybe into your hips as well. So if you get pain at any of these sites, that might be pelvic girdle pain. If you're really unlucky, you've got pain at all three areas. So
Mm,
it's like these two joints at the back called the sacroiliac joints. and then this joint at the front's the pubic symphysis, and you're likely to get pain kind of maybe coming into your groin, hip, all around your bum. They're all the common sites of pelvic girdle pain.
Yeah.
And I know that there's recognition there from you, Mel. You're like, yeah, tick, tick, tick.
Tick, tick, tick.
And
Yeah.
then the things that women tend to say, turning over in bed is agony at night. You know, you're getting all that pain at the front as you try and switch position.
Yeah.
Getting out of bed, and when you first start to weight bear, really struggling with pain when you're doing that, which is a nightmare because, you know, especially in late pregnancy, you're going to the toilet in the night all the time. And if you've got PGP, getting up and getting out of bed and walking to the bathroom can be really painful. The other kind of classic ones are they're probably limited in their walking, you know, how far they can walk. Even worse if it's like up and down hills or on rough ground. And getting dressed, if they struggle to put on a pair of trousers or pants and balance on one leg to put each leg in, that's a real classic PGP symptom as well. So you might have like all of those things, and I'd say if you tick all those boxes, it's very likely that you've got PGP. If you tick some of them, you might have it too. And it's also worth knowing that symptoms can be all different, and also they can be mild to really severe. So it might be that you just get like a bit of achiness and discomfort around your pelvis if you've walked for too long. Or, you know, at the other end of the scale, you might be, you know, on crutches or in a wheelchair and completely unable to weight bear. So, or anything in between, and you can move up and down that scale as well, depending on what kind of day you've had. You know, usually it's the day before. If you've overdone things, then you're going to, you know, feel it more the next day. So, yeah, symptoms are really varied and changeable, but those are kind of the key things that if someone says, then I think, oh, yeah, that sounds like PGP.
Yeah. No, that's brilliant. And I think what you were saying there about the difference that you can have from day to day, because I remember when I had it, I would sort of think to myself, oh, I've been all right for a couple of days, maybe I'm okay now, when I didn't know I had pelvic girdle pain, and I won't look for any help. And then I'd just have a day or 2 or 3 days of just being completely sort of, I would say, immobile. I mean, we've talked about pain, and you've mentioned sort of how you can struggle doing certain things because of the pain, but I think I remember from personal experience about it being impossible to do certain things. Like your body just wouldn't move in a certain way.
Yeah, you're right. As well as the pain, it's the instability in the joints which prevents you weight bearing on them. So I had one patient about 6 months ago, and she had quite severe pelvic girdle pain, and she was telling me at a session that she got stuck halfway down the stairs and she couldn't go back up and she couldn't go back down. And she said I wasn't in agony, I just couldn't move. I just couldn't like move either leg to get up or down the stairs. And she said like her husband was there and she was laughing because she was just stuck. Eventually she must have managed it, but that's the other thing. Sometimes it's like you literally can't lift your leg in a certain direction to move, and it's not always that it's agony to do so. It's that it won't go. I remember myself, I think it was with my second pregnancy, which was during lockdown, so everything was on Zoom, and I tried to do this Zoom Pilates class, and I was on all fours, and she just said, right, on all fours, lift one leg back out behind you. And I just couldn't lift my leg off the floor. It just wouldn't move. And it wasn't that it was painful, it just wouldn't engage and lift. And I thought, I think this class isn't working.
I don't think so. I know. I remember when after having Fran, I thought, just come on, let's do some exercise. You're probably just unfit. You know, you've had a baby. Like it must be like this for everybody. And I stood in the bedroom trying to do some yoga, and I couldn't get my legs wider than this. They just wouldn't move. They just wouldn't go wide. And I was like, come on, man! Like this must just be flexibility, but it's not. It's like it just doesn't work, does it, in certain
Yeah,
ways?
yeah. And the key
Yeah.
thing, so on my Instagram account, I share lots and lots of information about, pregnancy in general. And you
Yeah.
won't really see me sharing exercises for PGP, like
No.
do this top tip if you've got PGP, because there isn't one exercise that is great for all people with pelvic girdle pain,
Yeah.
because everybody's body is affected slightly differently. Some people can do some things and can't do others.
Mm.
And at the core of it, it's unstable instability in the joints. So
Yeah.
it's not always something you can, do some stretches and you'll relieve it, because the issue is that the joint is unstable. So it's
Yeah.
not something you can kind of like, you'll do no favors if you just like try and push through it or
Yeah.
walk it off or, grit your teeth and bear it. You're not going to be helping your joint stabilize by doing that.
Okay. So what would you think then? So if someone was to ask you, so and I think that's really, sorry, just to go back to that point about you don't share exercises, because I think there's so much out there, isn't there, of do this if you
Mhm.
have pelvic girdle pain, on the YouTube sorts of things, if you're trying to sort of self-treat, because um I know, yourself, you've got to, because if chiropractor's out of the NHS, it's a charge, you have to pay
Mhm.
for that
Yeah,
service kind of thing.
yeah,
So people are, especially in this sort of day and age, the world we're living in, they're looking to sort of help themselves at home, aren't they? Which is really understandable. Um, and so I wondered, maybe, so doing those videos, what would you advise anybody who finds these videos or is looking for these videos? Would you suggest to continue looking at them, or to
yeah. I would say if you can't get, personally assessed and
yeah,
have like some, hands-on assessment and treatment, then you need to try it and see basically
Mhm.
whether it works for you or whether it doesn't, and like really try and tune into your body and whether it's um telling you that you can't. It's hard to describe really, but yeah,
Yeah,
I think you might find something that really does work for you,
yeah,
um and then by all means carry on, and if you feel like it helps and it improves your mobility, then great. And I do give exercises out to
yeah,
individuals.
yeah,
I just don't think there is a one size fits all. And I wouldn't want to give an exercise and for someone it makes them feel worse. And then they think, oh, well, she said I should do this if I've got PGP, so I really should crack on with it,
yeah,
because it might not be right for that person. And my
yeah,
patients teach me that all the time. Like I used to say, don't swim breaststroke because that will make things worse. And then
yeah,
when I had pelvic girdle pain myself with my first pregnancy, I found I was actually all right with swimming breaststroke as long as I took it quite gently with the leg kicks. It didn't make me
mm,
feel any worse. So I don't say
mm,
that now. I say
yeah,
try it gently and see, knowing that you might only be able to tell afterwards whether you were
yeah,
all right with it or whether you've aggravated things.
yeah,
I've seen a few women over the years who have really struggled to walk, but have found that they can ride their bike and have found cycling was all right for them. So they've said,
yeah,
some even better than driving, have said, like, I get around on my bike because actually my pelvis feels all right with that.
mm,
And that's not going to be the case for every woman,
yeah,
but yeah, it's so varied that it
yeah,
is a little bit of experimentation on what works for you.
yeah. Amazing. Thank you. So we've talked about the symptoms, we've talked about how many people and how common it is to have PGP, which is amazing. We sort of started then to touch on your approach, I guess, to treating women that come to you with pelvic girdle pain. But I
Yeah.
wonder if you could talk about that sort of, so from the moment you sort of have contact with this, this lady who's come to you with these symptoms,
Mhm.
how do you then approach sort of your practice? What do you do for them?
So their first appointment, and anytime you see a chiropractor, your first appointment is always going to be a consultation. So we will sit down and have a chat about what your symptoms are, what your pain is,
Yeah.
what makes it worse, what makes it better,
Mm.
how severe it is. Are you getting it every day, all day? Is it just at odd days? And maybe your history as well, like if you've had any history of trauma, like broken bones or a car crash, or something that may have affected your pelvis in the past.
Mm.
And then we take a kind of broader history of your pregnancy, your medical history, everything. So we have a good old chat, and from that I'm already forming a picture of what might be going on for you.
Mm-hmm.
And then we'll do an examination. So we're looking at posture and weight bearing. We'll probably get you to walk up and down for us and see how you're weight bearing and how you're switching your weight from leg to leg. And then I have people standing and I get them to lift each leg up. And what I'm doing is, as you're lifting your leg, I'm looking at how the pelvis moves as you transfer weight between legs. And also maybe asking you, when you lift your leg, where are you feeling it? Whether you're getting, pain in the front here as you lift each leg, or whether it's pain in the leg that's you're standing on. And then I'll have you lay on my bench. I've got a big cushion with a hole in the middle so pregnant women can lie on their front. And I'm going to palpate the joints, which means using my hands to feel the joints and putting a bit of pressure on them, seeing how much they're moving and in which direction.
Mm-hmm.
And then I'll feel this joint at the front as well. And I'm also going to be looking at all of the muscles and some of the ligaments around the pelvis, because obviously we're not just skeletons, and our muscles and ligaments play a really big role in our pelvic girdle pain. So I'm going to assess all of those. And then once I've assessed you, we'll have another chat and I'll say, this is what I've found in your body, and this is what I want to do treatment wise. And then there's a chance to ask questions and, discuss things in that appointment. And then we get on with treatment. So treatment for pelvic girdle pain, again, it's different for every person because it depends on exactly what my findings are. It might be that two of the joints are functioning quite well, but one of them's not. And then we're going to focus on that one joint. It might be that two of the joints are too mobile and unstable, and one of the joints is really stuck. So depending on what I find, that's what the treatment's going to look different. But for people who come and see me, everyone with pelvic girdle pain, I find, has a lot of muscular involvement. So the first thing I do is lots and lots of deep tissue massage to release all the tightness in those muscles. Because usually when you've got an unstable pelvis, you've got muscles that are clinging on for dear life, trying to hold everything together. And then when they're really, really tight and tense, they're not really able to do their job very well. What we want is muscles that, when you're at rest, so like when you're lying on my treatment bench, they should be letting go. And then when they need to do their job, they're able to contract as needed rather than stuck always tight. So that's the first thing, lots and lots of deep tissue work. We can do some work around the front of the pubic symphysis. I don't do anything internally. And then we can manipulate the joints. And if you see a chiropractor, there are lots of different ways of doing this, and chiropractors sometimes call it an adjustment, which is the chiropractic word for manipulation. So we're going to restore the movement to the joints that are too stiff to help stabilize the joints that are too mobile. And this is where sometimes you'll hear the crack, which chiropractors are known for. Sometimes you won't, and there are some techniques that can restore motion to joints without that crack sound. But yeah, that's what we're kind of known for better or worse. So
I always remember that
mostly
moment being
treatment
really
will include
satisfying.
a bit of manipulation and soft tissue work, and then some advice about, movement and daily life, and perhaps some exercises depending where we are in your treatment. But yeah, the key thing is that it's always an assessment of the individual and what's going on in their pelvis. Because to say PGP, that's like an umbrella term, and then we can dig deeper and say, well, in your case, it's this joint's doing this and this joint's doing that, and it's a lot more detailed.
Amazing. Thank you. Yeah, I'm sorry I talked over you there, but when you talked about the crack, I feel like that was literally, I was waiting for that moment within sessions. It was
Yeah.
such a
And a lot
satisfying
of
feeling.
people are a little bit fearful of, oh, having your back cracked, especially
Yeah,
when you're in so much pain and you just, I've seen women who I can barely touch them because they're in so much pain.
yeah.
But as you yourself know, Mel, often the deep tissue massage is often more tender than the actual manipulation.
I totally, yeah,
And it's,
absolutely.
I'm not going to say it's not painful. Sometimes it can be,
Mm,
but it's probably not as, bad as you're fearing. And if you're fearful of it, speak to your chiropractor and say, like, I'm a bit nervous about the
mm,
manipulation part. Could you either treat me without doing it, and we can, or they'll talk you through it, and you might sort of feel a bit happier about it when you know exactly what they're going to be doing.
yeah. And what
But it's
impact it
not
might
it's
have as
not
well,
like
isn't
all
it? So what the,
videos you see on the internet necessarily.
no. That's such a good point, and it's really good to hear that, because I'm sure there are a lot of people who are very fearful of having anything done to their back and in general the spine, that kind of
Mhm.
thing. Um, I guess understanding how it's going to help you is good to know as well. You know what the impact of the purpose of what you're doing is really
Yeah,
good for them to hear as well, isn't it? Just to
yeah,
reassure them. And yeah, I mean, like you've just said about the deep tissue massage being painful, like yeah, it's really intense. It's very uncomfortable, but if we think about the pain that women are in anyway, you
mm,
know, that it's a pain with a purpose, isn't it? Whereas you're walking around or not walking around with pain constantly, like chronic pain
yeah,
anyway. And this hopefully is going to be a pain that's actually helping you get better,
yeah,
which, yeah, but you know, it's a lot. And like
yeah.
you say, the fear is there, isn't it? And I guess if we're thinking about that, if we're talking about sort of that, the fear, and we're kind of coming on to more mindsets, I guess, now, which would be
Hmm.
really good to talk about, because we've talked a lot about the physical impact and the pain and how it can affect what you're doing.
Mm,
I guess, could we have a chat about sort of the impact that it has on your mental health being in this chronic pain, and the
yeah,
impact that it just has on you as a person having pelvic girdle pain?
yeah, yeah. I mean, I think anyone who's in chronic pain can't not be affected by it.
Mm,
Because it's your all day every day, isn't it? If you're in really severe pain, but I think with pelvic girdle pain, it's the pain, and it's
mm,
also the not being able to do the daily activities that you took for granted before you had it.
mm,
Just like
mm,
getting dressed in the morning becomes just the
mm,
biggest battle. And then even kind of going out and socializing and seeing your friends becomes a lot more difficult. I
yeah,
had, when I had pelvic girdle pain with my second pregnancy, we were in lockdown, and the only way we could see our friends was to meet for a walk.
yeah,
And I couldn't walk. So it was like really, really frustrating and difficult. And, to try and plan your day and figure out how you can go and do an activity when you're like, I'm going to be on my feet, even like going to, say, a family wedding or something,
yeah,
when normally you wouldn't really think twice about the fact that you're going to be on your feet most of the day.
yeah,
Something like that becomes a huge mountain. So
yeah,
it's just incredibly frustrating. And the other thing is, pelvic girdle pain often hits you out of nowhere. You probably haven't had any history of back or pelvic pain. So, you know, you're like, great, I'm pregnant. And then suddenly, however fit, active you are, it doesn't discriminate. And you might be one of the unlucky ones that suffers with pelvic girdle pain. And suddenly, all your thoughts for having a really active, healthy pregnancy, suddenly, this curveball hits you, and you've got to rethink everything.
yeah. I love what you've just said there about it doesn't discriminate, and how you don't have people who are the fittest people ever,
Mhm.
can get
Yeah,
this. That's such a powerful thing to hear, because
yeah,
I think a lot of well, I certainly felt it, and I know a lot of other women do, is they just feel like it's their fault, like they weren't fit enough before they got pregnant.
Yeah,
And that's just simply not the case, is it?
it's not. It's not. I see women, who are very like CrossFitters, really, really fit and active, and
Yeah.
then they get pelvic girdle pain, and it absolutely, you can't tell if you're going to get it. I'd say there were maybe a couple of, I suppose, risk factors. Like if your joints are already quite hypermobile, you might
Okay.
be a bit more prone to getting pelvic girdle pain.
Mm.
You may not, but more often than not, you're just unlucky.
Yeah.
There's not anything you could have done to change it, or to predict that you would be someone who got it. And yeah, usually, women have never heard of it until suddenly they get these symptoms, and then they're having to research and figure out what's going on with them.
Yeah. You mentioned hypermobility there, actually, and that's something that I was going to ask you about. Could you just talk a little bit more about that?
Yeah, so hypermobility. So it's quite a big subject, and I wouldn't say I'm a hypermobility expert.
Mm.
There are different, as with pelvic girdle pain, there are different classifications within it. So there's something called hypermobility syndrome, and there are different types of that. And then there's another diagnosis called Ehlers-Danlos syndrome, and they are both probably, I think they've discovered that there are genes for them. So it's a genetic condition where your collagen is different. So your collagen is naturally more stretchy. So that affects all of the joints of the body, and then it can also affect things like the valves in your heart and the blood vessels, and there are lots and lots of related symptoms that aren't just musculoskeletal if you've got those conditions. And then there's like the normal population. Some people naturally have quite stiff joints, and some people naturally have quite mobile joints. And then we're a spectrum. And those people aren't necessarily kind of diagnosed with hypermobility. They're just like, I'm more naturally flexible and I'm more naturally stiff. So
Right.
I've treated all of them, like people with the diagnosed hypermobility syndromes and Ehlers-Danlos syndrome, and then people who are just quite flexible, like that. I fit into that category myself. And I remember before I had my kids, I thought, oh, I bet I get pelvic girdle pain, and then lo and behold, I did.
Right.
So yeah, it's hypermobility. It just means that your joints are naturally a little bit looser, and then when you have add pregnancy to that, and then pelvic girdle pain as well,
Yeah.
you're more likely, I think, to suffer with pelvic girdle pain.
Okay. Um, and in terms of treatment for people who have hypermobility, would you say there's a difference in the amount of time it takes to recover from pelvic girdle pain if you're hypermobile?
I would think so. Yeah, yeah. I think it's
Yeah.
generally treatment is more difficult and takes longer.
Okay.
And long term with hypermobility, it's strengthening,
Yeah.
because you're not going to change your collagen, and
No.
you're not going to change your joints. So
Mm.
what you can change is your muscles. So it's by strengthening all of the supporting muscles that kind of hold and stabilize your joints. And the stronger they are, the more resilient they're going to be, and better they are at stabilizing your joints. So the long term um, treatment, I suppose, for hypermobility is strengthening.
Yeah. Okay. Um, Thank you for that. Another amazing, hopefully very useful answer for people. um, so we've started now, I guess, talking a bit about treatment times and how long it can take
Mm-hmm.
for somebody to recover from pelvic girdle pain. And I
Yeah.
think, especially, I think one of the things for me when I found you was how long am I going to be like this? Now I know what's wrong with me.
Yeah.
And I'm guessing a lot of people feel the same and have that question. What would be your answer if someone asks you how long am I good? Is it going to take
I'm
me to
going to
get
say it's a
there?
piece of string, Mel. So the shortest, I've had people with fairly, mild symptoms. Maybe it's just affecting one sacroiliac joint.
Mm,
The shortest is one treatment. I've had some women who come in and they say, "Oh, I've got this pain here."
wow.
One treatment, one manipulation, and then they can walk normally again and they feel fine. So that's
Amazing.
the kind of shortest. And then the longest is years.
Right.
So it depends how severe the symptoms are,
Mm,
what your life is like. If you've got 3 kids that you're running around after and you've got no help, then it's very, very difficult for you to get any rest in life in general. But you're constantly kind of having to re-aggravate, and your joints are probably getting inflamed quite a lot. It's when you discover it during your pregnancy.
yeah.
So I will say, again, speaking really broadly, and everyone's different, tends to be that the earlier in pregnancy it starts, the more severe it's likely to be. If it persists after pregnancy, that's a more severe kind of diagnosis, so tends to take a bit longer.
Mm,
If it's moderate severe pelvic girdle pain during pregnancy, then it's not that common that I will completely cure it during the pregnancy. We're
okay.
often talking about kind of getting it as pain-free as we can, and allowing them to remain as mobile as they can through the pregnancy. And then afterwards, we're looking at really resolving it.
Okay.
Um, yeah. And I've seen a
Yeah.
few women who never had it treated during their pregnancy and then put up with it postpartum. I've seen one lady who was 3 years postpartum and she'd never had it treated.
Oh,
She'd just kind of like suffered on. Um, and she didn't actually need that much treatment to get her pain free. So it's frustrating that she waited so long to get
yeah.
seen. And now
Mm.
she's, running 10Ks without any issue in her pelvis.
Oh,
And actually, she's just got pregnant again. So
wow.
this time we'll do treatment during pregnancy.
Yeah. Oh, bless her heart. Oh gosh. 3 years. And when we talked about the mental health impacts of this chronic pain,
Mm.
going through that for 3 years is such a long time.
And I think for a lot of women, when you become a mum,
Mm,
you're so kind of consumed with looking after your baby that often your own health takes a back seat,
exactly.
which is a shame. But I think
Yeah.
a lot of people do put up with it, especially if it's not, really severe pain and they can kind of get by.
Yeah.
Or if, they have periods where it's not too bad and then
Yeah.
flare ups and then it's all right again, then they can not seek treatment when they should do,
Yeah. Kind of learning to live with it a little bit and
which is probably a
yeah.
kind of female toxic trait of us not putting our needs first.
Absolutely. Yeah. Absolutely. Absolutely. And I guess, did she know that she had pelvic girdle pain, or was she just living with the pain, thinking, "Well, I've had a baby. This is what my
Yeah,
body's
I
changed
can't
now."
remember. I don't think she realised it was PGP. I think it was probably
Yeah.
one of her. It was a friend of hers came to see me and
Mm.
said to her, like, why you've still got this pain? Why go and see Sally?
See
So I
Sal.
think it was only when her friend said, you're
This is
still in pain
normal.
after 3 years, that's not right,
Mm.
that she
Yeah.
sort of thought, actually, no, she's right. I do need to get this looked at.
Yeah. Yeah, no, I think I can imagine that being very common because, well, for all the reasons you've just said, really. But for me personally, I didn't realise I'd got pelvic girdle pain until 3 months postpartum. But then I met up with, well, I was going to a baby class actually the following weekend. So we'd done some research and whatnot. But my friend was a midwife, and she said to me, because I was kneeling on the floor, I couldn't cross my legs, and you're surrounded by
Mm.
people in these baby groups who were sat with their legs crossed,
Which
and
are
I'm like, "How
always
are
on
you
the
all
floor,
doing this?"
aren't they?
Oh, floor for sure. It was baby massage with my cousin. It was a
Yeah.
wonderful class, but they were on the floor and they're all sat there, and some of them have had their babies 3 weeks ago, and I'm like, how are you sat on the floor? You must be really fit. You must just be really flexible.
Mm.
Again, that sort of it must be me. I must be the problem.
Mm-hmm.
And this, my friend said to me, Mel, it's not normal. She was a midwife as well. It's not normal that you're in this much pain. You should be able to sit on the floor straight away. Obviously, depending
Yeah.
stitches and whatnot, and it really hit me that actually this is not normal, and it's a really
Mm-hmm.
important message to get out there to women. I think you've just said that women put up with the pain. And I think it's a really powerful thing to know that it's not normal and it can be treated.
Yeah.
You
Yeah.
know,
There's still too many women who are not kicking up enough of a fuss about it, to be honest.
yeah,
They're sort of just silently suffering
yeah,
and almost just, yeah, like living with it,
yeah,
putting up with it, not
mm,
prioritizing it.
yeah,
Yeah, which they shouldn't have to.
yeah, yeah. Okay, we've talked about so much there. That's
Mm-hmm.
amazing, and I guess you also just spoke about your one of your clients who's now having another baby, which is
Mm-hmm.
amazing.
Mm-hmm.
Um, what is your advice to people who have had pelvic girdle pain in one of their pregnancies and then want to have subsequent women babies
Yeah,
afterwards?
that's a really good question because it is, if you've had it once, unfortunately, it is likely that you will get it again with
Okay.
subsequent pregnancies. I've seen a couple of cases where women haven't, where women have had it, even like fairly moderate, and then the next pregnancy they've not had it at all, but they are the minority. Most
Okay.
women, if you've had it once, you probably will get it again. But a lot of women I see in clinic, they say, this time round, I know exactly what it is. As soon as I got that first symptom, I knew what I was dealing with. So I didn't, you know, suffer on and persevere and try and walk further than I knew I could. Um, they got the treatment earlier and they did the right things, and then they draw in help. If you've got
Mm,
a helpful mother-in-law or friends who can, just help you
mm,
with school pickup or whatever. I think second time round, you're a lot more educated to what you're dealing with, so you do the right things
yeah.
during the pregnancy.
Mm,
Um, Between pregnancies, I would say the best thing you can do is probably the more strength you can build in the muscles around your core and your pelvis and your glutes, and maybe get your pelvic floor looked at as well. Um, that will probably stand you in good stead for future pregnancies. I'm not going to say it will prevent it, it might not, but it's worthwhile doing that between pregnancies.
mm. Amazing. Thank you. One of the things that we wanted to sort of have a bit of an understanding on is once you've been treated and the pelvic girdle pain has sort of gone,
Mm-hmm.
is it possible for it to come back even when you're not pregnant and have sort of a
Ooh,
relapse?
good question. So, for the majority of women, I would say that they just suffer with it during the pregnancy.
Mm,
Maybe they get treatment during pregnancy.
yeah.
After they've had the baby, the symptoms clear up quite quickly. So
Mm-hmm.
that's the majority.
Yeah.
A minority of women still get symptoms after the baby's been born. Um, the longer it goes, if you've had treatment and it's completely resolved,
Mm,
you might get a bit of a resurgence of symptoms. So some women, I find, when with their period, they get a little bit of pelvic girdle symptoms come back each month,
yeah.
much more minor than when they had it during pregnancy, but it's just a sort of slight reminder. Um, and it's also still possible to kind of injure your pubic symphysis if you were I don't know, dancing at a wedding in high heels or something like that.
Yeah.
Like doing something maybe that you don't normally do.
Yeah.
Um, you might get a return of symptoms. I
Mhm.
would say it's usually kind of much less than anything you suffered when you were pregnant.
Yeah.
But yeah, it's definitely possible.
Okay. We talked a lot when you were treating me about how this isn't on the list of questions either, so I'm sorry, this is off the
Mm.
cuff. About it being linked to hormones potentially. What are your feelings on that?
Yeah, so it's really interesting because I know quite a lot of the pelvic partnership um, advice is that it's a
Mm,
mechanical joint problem, not a hormonal problem.
yeah.
And for the main part, I agree. Like it's a it's a joint problem, and I
Mm,
really don't want women to be bobbed off with, oh, it's just your pregnancy hormones and it's normal, and
yeah.
everything's a little bit looser because you're about to have a baby, and so that message is a fob off.
Okay.
It's not normal. It is a set. PGP is a diagnosis within pregnancy. It's not just part of pregnancy that should be
Mm,
accepted. So I wholeheartedly am on board with that message.
yeah.
However, I think for a sort of small subset of women, there does seem to be more of a hormonal aspect to their PGP than
Mm,
others. Um, and these are the women for whom it starts quite early in pregnancy. It maybe persists afterwards. Symptoms tend to fluctuate with their menstrual cycle.
yeah.
And sometimes I find it's women who, if when we're doing the consultation, it sounds like that, I'll say, like, what were your periods like before you got pregnant? And it might be the women who've always had, bad periods or, bad PMT or, have really like suffered from with their hormones
Yeah.
pre-pregnancy. And I don't know, like I'm not an endocrinologist, I don't know um what the interplay of the hormones is, whether it's that they've got higher levels of circulating hormones or whether it's they've got
Yeah.
more hormone receptors, or I don't know exactly what it is, but there does seem for some cases to be more of a hormonal kind of aspect of it than for other women.
Yeah. Okay. That's good to know.
Yeah. And
Um,
sometimes it's also the women who in first trimester get really bad sickness,
yeah.
which again is, a reaction to your own hormones. And so they'll get sickness, and then just as the sickness sighs off, then the pelvic girdle pain starts, which is the most hellish pregnancy.
Mm,
But I feel like I've seen too many cases of that for there not to be a bit of
a
a
link.
link.
Yeah. Yeah. Okay. So we've talked a lot about, thank you, sorry for that. But we've talked a lot about the pelvic girdle pain impacting you throughout your pregnancy, and we've talked about it being
Mm.
postpartum as well, or potentially postpartum too. Whilst pregnant and obviously preparing for birth,
Mm-hmm.
which for a lot of women is quite a daunting prospect anyway, isn't it?
Mm.
Without this to
Absolutely.
contend with as well. Um, Have you, or do you ever get asked for guidance by your clients as to how they could have a vaginal birth?
Mm-hmm.
And if, like, how do you speak to your ladies about that? Do you
I
give them
love
any
to
advice
speak
on
about birth
positions or anything?
preparation.
Sorry. Yeah,
So, this is, I mean, I feel like I have to give the caveat, everyone's different.
of
There are
course.
some women with really, really severe pelvic girdle pain, maybe they're wheelchair bound,
Mm,
who book an elective C-section because they're
mm,
just like, I am so immobile, I've got no idea how I would ever, go through labour. And that's absolutely, the right choice for them. If
mm,
a woman wants a vaginal birth, um, these are my common things that I'm kind of advising. If you are kind of apart from the pelvic girdle pain, if you're low risk midwife led, or even if you're not, maybe if there's any possibility of you having a water birth, I absolutely think that that is the best way for someone with pelvic girdle pain
Okay.
to be able to be mobile during their labour, and also to push their baby out with minimal stress on their joints. So, yeah, I really think considering a water birth is a good idea with PGP. Speak
Okay.
to your midwife. I'm sure
Mm.
different trusts will have different guidelines, but most of them want to know that you can get yourself into the pool safely and out of the pool safely. So as long
Okay.
as you can, you know, demonstrate or convince them that you can do that, then you should be good to have your pool birth.
Okay.
The least good thing to be doing with pelvic girdle
Yeah.
pain
Yeah.
is to be birthing lying on your back with your legs
Yeah.
up in stirrups, because when we're giving birth, actually PGP can be a bit of your superpower, because we want the joints to be loose and unstable when we're pushing a baby's head out of our pelvis.
Okay.
So I often find women with PGP are, oh God, how am I going to cope with birth? A
Mm.
lot of them manage better in the labour than they think they're going to.
Yeah.
And I would say a lot of them have really great births.
Yeah.
So being able to just be upright and resting your weight on something, so putting your arms on
Yeah.
a table or the side of the bed or something, so you're
Mm.
taking most of your weight through your upper body
Mm.
during labour, and then when you're actually pushing your baby out, what you want is for your sacrum to be mobile enough to move out of the way,
Mm.
so that not all of the stress is on this joint at the front. When
Okay.
you're lying on a hospital bed, you're lying and putting all your pressure on the sacrum, and then you've probably got your legs, out wide, or maybe
Yeah.
even in stirrups. There's a
Mm.
lot more stress that's going to be on this pubic symphysis joint. And if that joint's already unstable or maybe
Mm.
slightly separated,
Yeah.
that's not the best.
Okay.
And I'd also say the same about having vaginal exams. The fewer you
Mm.
can get away with having, the
Okay.
better, because for those, you're going to need to be on the bed on your back with your
Mm.
legs apart. If you end up in that scenario, I would say you need to communicate. Sorry, can you hear my kids in the background there?
Yes. Okay. Don't worry.
You
It's
need to be
lovely.
able to communicate to your midwives. I need someone supporting both of my
Yeah.
legs. So you might be against the wall with one leg and then
Yeah.
having someone holding your other leg. So you're not just letting them,
Yeah.
flop out. You need to have somebody holding and taking the
Mm.
weight of each leg.
Yeah.
Um,
That was amazing advice. I think that question came from one of the newest members of the Pelvic Partnership Committee, because she was really, and I'm sure she won't mind me sharing this. Her story is actually on the website. It's a really powerful story. It's a very positive story as well. She had treatment for her pelvic girdle pain whilst pregnant and ended up being pain free, which was incredible for the latter half of a pregnancy, latter part of a pregnancy. But yeah, she asked that question because I think when she first joined one of our calls, she was suffering at the time and she was very, very nervous about it. So knowing that there's the possibility of any kind of birth, and that giving that advice to people as to positions and things and the support that they can actually ask for from their professionals or their birth partners is
yeah,
amazing. And I think you opened up as well with, some women go for and elect for a cesarean, and I mean, my goodness, why not just
yeah,
birth is birth, and um it comes with a lot of, I think there's a lot of expectation, um and all the things that come with birth. I could talk about that for a long time, but I think just knowing that it's your choice as well, and there
hmm
are options to birth however
yeah,
you are feeling most comfortable, and it
yeah.
is
And like
amazing.
your experience, Mel, you
Yeah,
had severe pelvic girdle pain
yeah,
and you had a home birth in a
yeah,
pool, you know.
yeah,
So
Well, I actually gave birth on the toilet in the
Oh,
end.
did you?
We had the pool up. Gareth, this is it. Gareth still sore about it today. Put the pool up and everything. And I didn't even go downstairs, but
Oh, did you?
no, I didn't even go downstairs. Poor man. It was like he's just going to
Okay.
hop in it himself at one point. But yeah, no, I did. You're right, and I didn't know I had pelvic girdle pain at the time, but I was in a lot of pain. I was very much struggling to stand at times. Um, and I did have, like you say, I had a home birth, so I think um, the possibilities are there. But I just, like you just said so many times in this chat, is that everybody is different, and it's okay to listen to yourself. You said that earlier as well, like
Yeah,
do what feels right for you.
yeah,
You can sort of try positions out prior, and sort of see what your body can do. But your body changes when you're in labour as well, doesn't it? The
yeah.
relaxing comes in,
I
and the
do
hormones
often
help
find
you
that
and aid you.
people
Yeah,
are less affected in labour by their pelvic girdle pain than they think they will be.
yeah,
That's again, like speaking really generally,
yeah.
but yeah, I would say don't write off having the birth that you want because of your
Yes.
pelvic girdle pain.
Okay. Amazing advice. Very reassuring, I think. Definitely for a lot of the women
And
hopefully
that I
watching this.
remembered the other thing I wanted to say. If you have an epidural, um, you need like if you're having like a labour ward birth and you've opted for an epidural, which absolutely like is a great option,
Yeah.
but you need to communicate to your providers that you've got PGP. So
Yeah.
even when that epidural's in place and you're not going to be feeling anything in your pelvis or your legs,
Yeah.
they still need to be supporting your
Yeah.
legs, not just letting them go. Because that,
Okay.
yeah. So I would write a birth plan, a
Yes.
PGP birth plan. So you
Oh, I
communicate
love
like,
that idea.
this
Yes.
is what I can and can't do,
Yeah.
and I need that to be respected in labour as much as possible. It might be that, if there's fetal distress and they really need to get that baby out in an emergency situation, that
Yeah.
they're going to be pushing your legs up. And, we
Yes.
can't always plan for every eventuality, but it's
No.
definitely worth having a PGP birth plan.
Yeah. And just giving yourself the best chance, I guess. You can make that decision as, the choices are with you until, throughout your labour, aren't
Mm.
they? They are your choices. So,
Yeah,
if you understand the impact of that on your body potentially, you weigh up that risk, don't you? And then you can make that choice as to what you're happy with happening in that
yeah.
moment. So it's a really empowering stuff to hear. It's really good
Mm.
to know. Thank you. Um, yeah, we've talked about loads. Is there anything else that you'd like to sort of add at all about what we've talked about today,
Mm.
or any advice that maybe you'd give to somebody who has or hears the symptoms that we've just talked about and thinks that's me?
I think it's very easy when you are in it, especially if you've got pain postpartum, to think almost that you can't imagine not being in pain anymore because
Mm.
it's just so part of your daily life.
Yeah.
But I've had so many patients who have been really severe and then have had treatment, and then there was one woman I remember when she first came in, and she was a really rare case actually. She hadn't really suffered with it during her pregnancy. Her symptoms were all postpartum, and
Yeah.
she came in and everywhere hurt, and I could hardly touch her to examine her. She was so tender.
Mm.
And we did treatment. It was probably over the course of about a year. Um, and then I bumped into her. I can't remember when it was. A bit after, like I discharged her. Maybe I bumped into her about 6 months later or something in John Lewis. And she went
Yeah.
to me, "Oh, I'm doing really well. Like I've started doing tennis lessons." And I just like, my
Yeah.
heart sings when I hear, somebody doing something really like physical and challenging that they couldn't have dreamt of doing, when they were really suffering.
Mm.
Um, but yeah, just know that how you are right now is not
Mm.
how you'll always be.
Yeah.
Welcome.
I'll stop recording in a minute. But I hope everyone who's watching this finds this really useful. And if you hear anything about what Sally said today, And if it's resonating with you and you think it's your experience, then please do get in contact with somebody to get help. Look on the Pelvic Partnership website.
Yeah.
There's a list of which Sally is one, but there is a list of recommended practitioners. They range from osteopaths, physiotherapists, and like Sally, chiropractors. So please do reach out and get some help.
Yeah. And to be honest, if you're thinking, have I got pelvic girdle pain?
Yeah.
You probably have. You know, if
Yeah.
you've got some of those symptoms, you probably have, and you're not just moaning, you're not just complaining about nothing, and it's
No.
not just normal pregnancy, so put
Yeah.
up and shut up.
Yeah.
It's a separate diagnosis, which is hard for a lot of people because
Yeah.
pelvic girdle pain is sometimes called sort of the invisible pregnancy diagnosis, because
Right.
unless you're so bad that you're on crutches,
Mm.
people don't know you've got it,
Yeah.
and they just think you're walking slowly and you're waddling.
Yeah.
So if you don't tell people how you're feeling, then nobody's going to know, and you probably won't get the support that you need.
Yeah.
Or you'll sort of internalize it and just think, oh, I'm not very good at being pregnant.
Exactly. Yeah, that phrase. I'm not very good at being pregnant.
Yeah, when
Oh,
actually you're suffering with pelvic girdle pain. Like, it's not just
yeah,
pregnancy.
it's not just pregnancy. Absolutely. And it's not normal to be in pain when you're
Yeah.
pregnant. It's not a normal thing.
Mm-hmm.
So it's really important to know that. Thank you so much.
Yeah. You're welcome, Mel. Pleasure to speak to you.
Oh, it really is. It really has been. It's lovely. Thank you very much.